All right. Well, good morning. My name is Dr. Tom Britton. I'm the president and CEO of the Gateway Foundation, and I'm just absolutely thrilled to be a part of this panel this morning. This is going to be so much fun. If you're not familiar with the Gateway Foundation, we are the largest nonprofit provider of addiction treatment in the United States. We provide over 8,000 people a day support with their substance use disorder, and we have a really big footprint in Illinois. And one of the programs I'm most excited about is the Out in Recovery program in Lake Villa. Marky, one of our counselors who's on today, is actually a counselor on that unit. So this is going to be awesome. This is one of many in a series of webinars that is part of our overall strategies to improve justice, equity, diversity, and inclusion in specific groups who have been victim to prejudice, violence, and inequities as a result of really a unique difference within that community. This particular topic is also very personal for me, and so it's even more exciting because I brought the shirt that I wore in the Pride Parade the last time that they did it. If you can't see this, I am also the proud brother of a lesbian sister and my sister-in-law. I'm just so proud to be a part of that family. So I want to start and introduce members of our panel. This particular panel is going to focus on the LGBTQ plus community. And we've chosen people to participate who are not just members of the community, but are also healthcare leaders and providers in the state of Illinois. And what's unique about this series is it's not just about the larger issue of social equity, that it's also about kind of the employment experience of members of the community. And it's designed to raise awareness and remove ignorance of people who are working with members of different groups. And so first I want to introduce my team. And I'll start with Mr. Jim Blasco, who is our nurse manager director for our Central Illinois services. Jim's been a nurse for 27 years, and I found out very excitingly that he's marrying his partner this fall, who's just a really wonderful, sweet guy. So congratulations, Jim. I'm so glad you're on the panel. Mr. Mark Turner is my partner on my executive management team. Mark is the division president for our community-based services here in Illinois. And Ms. Marky Hylinski-Cody, who's one of the counselors. She's been a counselor for 9 years. And we're really excited. This is Marky's first webinar, so this is awesome. And also two real leaders in the Chicago and Illinois community that really interface very publicly and directly with the LGBTQ community. First, I want to introduce David Ernesto Minar. David is the president and CEO of Howard Brown Health. David's been really in the community here in Chicago, starting with the AIDS Foundation of Chicago, and now Howard Brown Health. And David, I'll let you say a little bit about yourself and your program.
Thanks, Tom, and thanks, Gateway. I'm excited to be here. I'm a longtime Chicagoan, and I run Howard Brown Health. We're a federally qualified health center with 12 sites from Rogers Park to Inglewood, serving 35,000 patients and clients. We have a focus on care for the LGBT community with programs like transgender health, gender affirming care, but also sexual health program for adults, adolescent care, so a whole range. But we also provide community health care for all Chicagoans. So we also, about 30% of our patients are not from the LGBT community. Happy to be here.
All right, thank you so much, David. And next is Mr. John Peller. John is the current president and CEO of AIDS Foundation of Chicago. Started there as a policy guy in 2005 and has really been supporting advocacy really in all AIDS-related and people that are at risk of HIV. John, I'll give you a chance to introduce yourself and talk about the foundation.
Great. Thank you so much, Tom. Thanks to you and the folks at Gateway for inviting me today, and excited for this conversation. So AIDS Foundation Chicago really has as its fundamental purpose ending the HIV epidemic in Illinois. And we do that through a number of ways, including leading advocacy around HIV and healthcare access for the state, and getting deeply involved in national issues, providing case management to about 6,000 people living with HIV in the Chicago metropolitan area, advocating for prevention access, and of course, providing housing to thousands of people a year in the Chicago metropolitan area. So that's the work we do at AFC.
Awesome. All right. Thank you so much, John. So, you know, I'm a therapist by background, public health doctor, and I always like to start personal. And, you know, I want to thank those on the panel because it's different going on a panel like this and talking about your personal experience versus your professional experience. So we're going to talk a little bit about both. You know, as the brother of a woman growing up in a community that was not accepted in the 70s and 80s, I had really kind of like a firsthand experience of what she experienced and her coming out process and coming to live in the world. And what I'm interested in each of you sharing a little bit about is, as your experience of a member of the LGBTQ plus community and its intersection with the workforce, I'd be interested in you sharing a little bit about what it's been like for you personally, working in healthcare, what lessons you've learned, and anything you'd like to share with our listeners. And Mark, I'm going to start with you, please.
Well, I think I'm the oldest person on this panel. So, you know, going back, you know, one of my earliest memories is when the Stonewall riots happened in 1969, and it made the cover of Time magazine. And being an 11-year-old at that time, not really understanding that, but very interested in it. And when I asked my mother about that, she ripped Time magazine out of my hands and said, "Those are bad people. You don't need to be reading that article." So, you know, when you look at growing up in a world, and that's not just simply inside of my core family of origin, but that's the world that I grew up in. And so, you know, my experience of coming out was age delayed. And, you know, Tom, I told you this story that I was going to share today, and that is after I was working with a youth group when I lived in North Carolina for helping LGBTQ youth as a volunteer. And when I was carrying their banner in the Pride Parade, I made the local television news. Well, you know, that caused quite a stir because of folks. And my boss said to me, basically, you know, it's turn the dial down. You don't need to be who you are, your authentic self at work or anywhere that would represent work. And, you know, I told Tom my experience of telling her that if she would at work take off her wedding rings and take her picture of her husband and children out of her office, then we'd be on level ground. And in those days, in the early 90s, I could have been fired for that in North Carolina with no redress. And so I think that for, you know, the folks that came along in my generation, it was a very difficult journey for all of us to feel that, you know, and watching, you know, through the 80s and into the 90s before AZT came out at the end of the 90s, watching a lot of people that I was very close to die, and going to AIDS funerals was also, you know, it's an experience that shapes who I am today.
Thank you very much, Mark. And Marky, I'll go to you.
Well, so I'm a little younger than most of you. So as you know, it's progressed and a little more mainstream and okay, but there's definitely still a long way to go. I remember in my personal life for a long time, I personally knew it, that I'm a part of the LGBT community, but it was kind of the shame and guilt because I also grew up in church and an active member of my church. And, you know, my church is pretty progressive, but at that time when I was younger, I didn't want to be open about it because I didn't want that stigma or, you know, like, you're going to go to hell because of who I am. But then, you know, as I grew up, I feel like that I don't and shouldn't have to hide who I am. And like I said, church being a big part of my life, actually, me and my pastor recently are now a all-inclusive church. So me and my wife actually were the first gay couple to get married legally in our church. So that's something I'm pretty proud of. Worked really hard on that. But, you know, professionally too, I, you know, like I wasn't ashamed, but I also wasn't like open about it. If people asked, you know, like if I was married, I was just like, yeah, I didn't go into any details. But then being here at Gateway and like working in the out and recovery program also gave me a little more confidence. Like I don't need to hide who I am. I shouldn't have to hide who I am. I'm proud of who I am, and continue to spread education, hope, inspiration, and hoping that, you know, being in the out and recovery program, I can inspire them to be who they are and not having to hide or feel that shame and guilt a lot of the time that society or their loved ones can put on them.
Awesome. Thank you so much, Marky. And it's interesting, you know, I think Marky touched on something interesting, which is, you know, there's certain work environments in certain fields where one can be more comfortable being out about who they are than other, you know, environments. And I feel very fortunate as a member, you know, of the recovery community. I'm a person in long-term recovery from substance use. That in my given field, there's no stigma. I can talk about who I am and what I am. That's not true everywhere. You know, David and John, you've spent a lot of time in that, but you also spend time out of that kind of work environment. I wonder, David, if you could first share for us, you know, kind of what your overall experience has been and what the intersection has been like for you.
Thanks, Tom. It is a great therapist question, and I actually really appreciate it because I think we forget how much has changed recently and how much hasn't changed. And I just appreciate hearing the stories of my fellow panel members here. So, you know, for me, I grew up in Albuquerque, New Mexico. My parents are immigrants from Colombia, South America. And like a lot of gay people in my generation, and even today, you know, coming out was possible, you know, kind of part of our coming out process, or my coming out process involved, you know, migrating to a big city like Chicago, and really making a decision early in my life that it would be hard to reconcile my identity and kind of my vision for my life, and, you know, close to home. You know, and so, you know, and I was fortunate to go to undergrad in the Chicago area, but certainly being, you know, I was definitely drawn to a big city and the anonymity and the freedom it could provide. And I think that experience is still alive today. I think, you know, from, you know, in the Midwest, we see people from Ohio and rural Iowa and all parts of the region coming to Chicago looking for that sense of safety and the opportunities to live their life without, you know, restrictions that they might have in a small town. So that was part of my experience. And professionally, I've definitely enjoyed a lot of opportunity to be out and to be safe. But, you know, I think some of my early experiences were not so much around my identity as a gay man, but as a person living with HIV. And, you know, in the 90s, I certainly, you know, I was working at AIDS Foundation Chicago early in my career, or most of my career. But I, you know, my 20s and 30s, I really had a sense of needing to have or fear about losing, maybe is the best way of saying it, fear of losing my healthcare insurance. You know, and so you know, I made decisions to stay, to not do things like go back to school, or, you know, or join a startup, or anything that could put me in jeopardy of having a disruption in my health insurance. And certainly the Affordable Care Act has alleviated some of those fears, but that, you know, for a lot of people now, you know, and again, that's speaking for a lot of privilege. Some people never had group-based insurance. And many of the patients and clients that we've dealt with at Howard Brown and at AIDS Foundation didn't have those opportunities. But that certainly shaped a lot of my decisions, was making sure that I could have the healthcare I needed to survive.
Thank you so much, David. That's a great perspective. And John, would you like to share on the subject?
Sure. Thank you, Tom, and thank you, David, for sharing that. So I'm incredibly privileged as a white cis male who works in a very, very gay office environment. Although actually, Tom, you have more pride flags and boas than I do, so I guess I got to step up my game. You've inspired me. So, there was a time when I was, in my 20s when I wasn't out, and that was really a struggle for me. It took me, a good couple of years into my mid 20s to acknowledge to myself and to my friends and family and coworkers that I am gay, and I remember just how hard and how challenging that was and how scary that time was for me. And just I'm so fortunate to have that support. And I just really try to remember that certainly not all staff at AFC, not all of our board members, for example, are open about their sexuality in their workplaces. And then we still have work to do at AFC to make sure that the organization is fully affirming. And an example of that is, working with a Black trans-led organization. We have realized that, wow, we really need to do some cultural competency work for our own staff. Still lots and lots of learning and growing to do. And I really appreciate all my staff and friends and coworkers who push me to learn and grow every day.
Thank you so much, John. And I have to give some of the credit to the fact that I have two very proud boys that support their and the Pride Parade is one of our favorite times of the year. So Jim, let me turn to you, please. I think Jim, differently than those others on the panel right now, lives in Central Illinois, where there are some different expectations and norms. And one of the things I've always been impressed and noticed of Jim, and I think this is part of the privilege, frankly, is Jim has never acted like there's something different about talking about his partner versus me talking about my partner. And that is a sign of where we are, but it's also a sign of who Jim is. And so, Jim, if you could share a little bit about you.
Okay, so, my generation is kind of closer to Mark's generation. When I was growing up, it was pretty much not talked about. I was raised in a big Italian Catholic family. So, I would hear the different remarks from even my family members. Going to church, I was always told, it's a sin and, you'll go to hell. So, it was very difficult for me to come out and be myself. And for many years, I didn't. I thought to myself, I have to do what my family thinks I need to do. So, I got married. I had kids. And I, throughout my 20s and 30s, lived a very depressing life. Yes, I loved my kids and my work and everything. It just wasn't what I really wanted. So when I did come out, it was very, things coming off of my shoulders, a big weight. I was at a faith-based hospital at the time. And when I came out to my friends and colleagues there, they were very accepting. It was very nice. But I still, didn't go around and, express, who I was and, what everything was about. But eventually I did find Gateway, and it was very nice to be in an environment that I could talk about who I was and the relationship I was in. When I did find my partner, it kind of opened my heart, and I could be who I was. And we've been together now 10 years, and like you said earlier, it's very exciting. We are going to be getting married in September, and thank you. I just can't wait for that day. And I can't wait to celebrate with my friends at work who are very, very excited for me. And I try to bring that to my work to help others that are in my situation, plus also trying to help our clients that come in that are scared. They tell me their situation, their home situations, their relationships. So I try to sit down and try to, relate to them and try to give them, some education, and always tell them there's someone there to help you, and it always gets better. So.
All right. Thanks so much, Jim. That's awesome. So, I think the next one I want to get to, I think that the social dialogue that's happening right now in the country has been really, really strong about race, for example. And I think people are more aware now of, things that are okay and not okay about kind of the normal way we interact with people about race. I don't think there's as much awareness, sensitivity, and understanding about interacting, really with members of the LGBTQ community, or even what behavior is okay or not okay. Something that I experience as a heterosexual male is people will sometimes say something in front of me with the "it's just us" mentality. And I think that probably everyone on the call can relate to that. Like, well, I don't think there's anyone gay in the room, so I can make a gay joke, or I know there's somebody gay in the room, but I don't realize I shouldn't say this, or that. And so I wanted to have each of you give a little coaching, really to the people on the call as people, of how should you be sensitive to promote safety. I think safety is the biggest catch for, in some ways, justice, equity, diversity, inclusion, because ultimately that's what it comes down to, is safety and opportunity. Is what coaching do you have for those people listening of like how you should be acting, in essence, related to this specific issue? And I think this time, Marky, I'd like to start with you, if you would.
All right, thanks, Tom. So I'm going to go back to like working out in recovery. Usually, obviously when they're in that program, it's because they identify as part of the LGBTQ community. And it's sad because I've heard several stories of individuals sharing it that they were purposely, called the wrong pronoun, or like bullied in that type of way. And education is huge, and as like we progress, I think it's okay to ask people what their pronouns are, what they want to be identified as, because I feel that it would hurt that person, or like me, more if they were to just assume, rather than just being open and honest and asking. And if there are people that, like you were mentioning, it's only us, so we can make like a gay joke or something along those lines, to stand up and and explain like that's not okay. We shouldn't be using that kind of of language, or just kind of educate them on the politically correct way to go about things. And I mean, education is huge, because if they don't know, they don't know, and that can be a learning experience for them.
That's great. Thank you so much, Marky. And I think, John, I'm going to keep mixing this up so you don't know who I'm going to call on next. John, I'm going to go to you if you want to weigh in on this.
Sure. Excuse me. Thank you. Yeah. So, Marky, you mentioned pronouns, and I think introducing yourself with pronouns can be a pretty powerful act, because it, I think, makes people think, well, why is he saying his pronouns? And sometimes ask the question, why did you just say your pronouns? I do find, though, that it sometimes feels really awkward if I'm the only one in a group who's introducing myself with pronouns. And I think we really take for granted at AFC now using pronouns, but that is certainly not the case, I think, in the wider world. So yeah, I think starting with pronouns can be a really good place to start to introduce the conversation and then possibly move it forward.
That's awesome. I added my pronouns. See, this is the best thing about this. It's like very seriously, and we'll talk about this in a minute, but I think there's a lot of ignorance, frankly, that's not intentional. It's just literally a lack of awareness. And one of the things that I experienced on this call before you all joined us, not those on the panel, but the rest of the world, is there's a neighborhood in Chicago that has historically been called Boys Town, and it's in the act of being renamed Lakeview East. And I didn't know that because I'm not a part of that neighborhood. And so it's like you learn every time you talk about it. David, would you like to weigh in on this one?
Sure. Yeah, I think folks have can have particular challenges thinking about things like pronouns or cultural competency for members of the transgender and non-binary community. And the thing that I try to remind folks is that at the core of asking and using somebody's pronouns is basic respect. It's that simple. And I hear a lot folks that will say that they have a really hard time keeping track or understanding, or they're afraid of saying the wrong thing around pronouns, and they kind of have this puzzled look, like it's this enormous mystery. And it's like, well, if somebody shows up, somebody that we've known for a long time shows up at the office and they're like, I got married over the weekend and now my last name is Smith. Everybody goes, they may, forget and use their maiden name at some point, but they come around and they figure out, and it's like, this person wants to use their married name now. That's their choice. And it's absolutely the same thing. I mean, pronouns at the core of referring to somebody by their pronouns is basic respect. And it's just showing them that everybody should, have the agency to be called whatever they want, and we all see this all the time. And so this is not mysterious. There are folks that don't like their name that their parents gave them, and they like another name, and they tell you. And so it's the same thing. So and it's okay to also make a mistake. Because at the core, if it's all about intent. So if you're intending, if you make a mistake, someone's like, oh, I don't use that pronoun. I'm using this pronoun now. I'm sorry. Correct. And mostly people just want to see that you have some interest in affirming who they present to the world, how they want to present, how they want to be called, how they want to be seen.
That's great, David. And Jim, you can kind of go on this. You can make it bigger, smaller. What's your perspective?
Well, when you were talking about being safe in the workplace and making people feel comfortable and all, how I feel, I've been in those situations. I have been in situations where, people look around and then they tell a Black joke. because there's no Black people around. Or they tell a gay joke thinking there's no gay people around. You know, when you bring it up, or other people bring it up to these people, you know, I've heard them even say, well, they choose to be that way, so we can talk about them, because if they didn't want to be that way, they could change. And so that's why I try to help educate everybody who, their backgrounds, the way they were brought up. I try to educate them on, we are just like everybody else. We did not choose to be gay, but this is the way we are. And, when you make fun of us, it hurts. So, that's what I do in my workplace, is try to help anyone that needs understanding of our community. And,
Thank you so much, Jim. And Mark, I'll let you round this one out.
Well, I'll jump off of what Jim just said, because I think it's really an important thing, and that is, all of us are trying to live the life that we are meant to live. And, there are pieces of this that are as innate as to whether or not you're right-handed or left-handed, and that are, the gifts of my Creator. Long journey for me to see this as a gift rather than a burden. But I think it's about the fact that as you navigate the world, you would expect other people to see you as a person and not an object or a representative of a culture or a group of people. I think we all want to be treated as people. I think one of our other panelists kind of focused on dignity and respect. I think that's all that any of us want, is to be treated as a person, to have dignity and respect, to be seen for the comprehensive, complex people that we are, because in addition to who we are in terms of members of this community, we all also have other dynamics that we're affiliated with. We're children. We, some of the people on here are parents. I'm not a parent. But, we have other roles, and we want to be seen as a whole person and treated with respect and dignity, and not having people make assumptions about us or how we live or how we choose to live.
Yeah, I want to thank you for that, Mark. And, I'll give kind of some of my experience on this too, is I think one of the most important things that we can do, and especially those who are members of the heterosexual community or something besides the LGBTQ community, is typically, if there's a warning voice in your head that says, maybe I shouldn't say this, then you just shouldn't. Trust your inner voice. Don't say, let me read the room and decide if I can say this, because if that's the thought process, then you're off base. But I think that the other part that I'd give is coaching. And it's been interesting, because this webinar series for me has provoked a lot of vulnerability for me, because as a straight, heterosexual, male, white, Anglo-Saxon Protestant, I'm not a member of any diversity group except for my experience as a recovering person. And so it raised some of the uncomfortability of like, what am I allowed to say and not allowed to say? What are the right words to say and the wrong words to say? And so I called Mark, for example, before this, and I said, the way I'm saying this in my head feels uncomfortable. Is it wrong? And Mark supported me and said, here's what I would encourage to you. And I think that everybody needs to have some courage to ask questions, like receive coaching and support from people that are different than you, so you can develop yourself. I think it's the only way we actually grow. If you sit in silence with it, you're not going to grow. And so I think courage is one of the big parts for anyone who's not a member of a diversity group, when they're with that specific diversity group. So let me kind of flip to organizations now for a minute. I think what I'm interested in each of you sharing now is, there's organizations that have made a lot of progress in creating safer, inclusive environments with opportunity, and those who haven't. There's many who think that they have, but actually haven't. I'd be interested in the coaching from each of you to organizations specifically, to those that have leadership experience who are on this call, of what can they do in their own organizations to create a better environment. And Mark, I'll start with you. And really, Mark is one of the architects of this in this organization. So I know a little bit about what he's going to say. But Mark, what would you share to me, frankly, as the CEO and others listening?
Well, I think that one of the things that many organizations have come to understand is that when you create exclusion of anybody from your organization, you're losing the knowledge, skills, and abilities for your organization to be successful. The reality is that if you exclude anybody who doesn't look like you from your agency, then everybody starts to look alike, and you go down this rabbit hole of groupthink with no diversity of thought or skill or knowledge base. And so, to folks that have perhaps not been as opening of their doors as perhaps they could be, I would say to them, you're missing out on an opportunity, because particularly there's a lot of intelligence, there's a lot of creativity, there's a lot of knowledge among members of the LGBTQ community that if you exclude us from your workplace, it's your loss.
Thank you, Mark. Jim.
Yeah, what I would recommend to different workplaces is just acceptance and tolerance. There are a lot of good folks in our community and very talented folks, like Mark said. Look at the qualities that we bring to the workplace. Don't worry so much about who we love on the outside of the workplace, but focus in on all of the quality, the traits, everything that we can bring to the business and be accepted. That's all anybody wants, straight or gay. So
thank you very much, Jim. And John, David, I'm going to ask you this question, but I'd like you to answer it kind of from two fronts. One is really what coaching do you have for organizations, but I'm also interested in how your organization specifically is really trying to increase your own strength in addressing equity, diversity, inclusion issues in your workforce. And John, I'll start with you.
Sure, thank you. So, Mark, I think you really made a great point about the business case for why diversity and equity and inclusion are important. And I think we at AIDS Foundation Chicago have been working for the past probably year and a half on our racial equity work, and specifically on a racial equity action plan, most recently with the Morton Group. And so we are in the thick of it right now, in all its messy, amazing wonder of planning and conversations around race and racial equity. But fundamentally, although we are doing some great work and have some great accomplishments, like, for example, our board is about 55% people of color. We have a Black gay board chair, but that's not enough, and we have more work to do to make sure that there's salary equity across the organization, both for LGBTQ as well as for Black and Latinx staff. Make sure that there's equitable leadership opportunities across the organization, and so and more. So I'm just so excited to be leaning into this work and excuse me, having the really difficult conversations about what racial equity looks like in an organization. And we have very deliberately centered racial equity because we know that once we address race, we'll then be able to address all the other issues too. So gender and gender identity and sex and sexuality, all of those will follow along. So we're making great progress, but we still have lots of work ahead.
Great, thank you, John. David.
Yeah, I think what John described is really also a really important concept, and one that's really critical to diversity, equity, inclusion, which is intersectionality. And this concept that people can hold multiple identities at the same time, and it influences their experience, their opportunities. It has enormous impact, and so for members of the LGBT community, this is a big issue. We're not just one thing. Our gender identity, gender expression, or our sexual orientation is not the only attribute that has impact or relevance in our lives, and kind of the communities we live in, the geography, our racial, ethnic, community of origin can impact us, our socioeconomic status, education status. So, I think really thinking about how all these things work together or may work together for an individual is really important. And the other is just that, that all of these, that everybody, that these are not just labels or ways of identifying that are unique to LGBTQ people. We all have a gender or gender expression or a race or an ethnic expression. So for Howard Brown, or actually for organizations, including Howard Brown, I think it's really important to think about policy development. And I think it may seem, we all get these packets, when you join a new company, of all the forms and all the kind of things that you say, we're not going to discriminate, we're not going to do this and that and the other, and people sign them and don't think about them, but they actually are really important. They set a standard, and they tell a person who's transgender or who's bisexual or lesbian or gay that this is a place that recognizes and sees you. So I think the policy is important, followed up with some training around some of these topics, and setting those norms that those side comments or actual discrimination or stigma are not permissible in the workplace. So raising visibility, and then tools for people to give coaching or constructive feedback, or file a grievance or complaint, and even at the higher level, as John described, critical analysis about things like the pay structure, and making sure that there's internal equity, market equity, or trying to find ways that inequity can manifest even when there's no intent. There's lots of evidence that males or male identified people are better negotiators at on salary than women. And so if your system is around rewarding who's a tougher negotiator, an entity could easily have gender pay disparities based on just who spoke up the loudest. So there's all sorts of really critical things, but I think the key is going to be policy. If you can't write it down and enforce it, or tell people at the beginning that this is kind of how we operate and what we value, it's going to be hard to set those norms. It has to be reinforced with some training and some tools, but it starts with the agency staking a claim that this is important.
That's awesome. Thank you so much, David. And so, Marky, you as a kind of worker on the front line, talk a little bit about your coaching to organizations, including this one.
So I love and agree what everyone else said in their coaching tools. One thing I would kind of go off on too is not being afraid to be like more gender neutral. A lot of times with like applications or like survey type things, if it will ask like what you identify as like sex, it would be like male or female. I know like some companies are kind of working towards, having other identities on there, or it will say like, instead of just checking a box, you can like write in what you identify as. And like small things like that, I don't want to say small, but in a sense, smaller things like that can make a huge difference to allow that person to feel comfortable and to be themselves. And, if there is any type of discrimination or harassment in that company, take it serious. And I mean, it's just like any other type of discrimination. And kind of set that precedence, like, hey, this is not okay. We're not gonna tolerate this. Also providing and having available like LGBTQ friendly like benefits and insurance. I know here at Gateway, actually, my wife is on my insurance, which is great and so helpful. But I know, like, for example, my mom's company wouldn't allow that. And, like, again, the smaller things, which I don't want to say like the word smaller, but things like that can make a huge difference on whether that person feels comfortable working there, if they feel safe, making sure that the company is proud that they're making a statement and support them and have a safe space. I think that's important and will make a huge impact if that person knows that, like, hey, my company and my employer has my back. They're gonna feel more safe. I feel that they're gonna work harder and give their all to that company.
That's awesome. Thank you so much, Marky. And if you missed it, I think her ringtone was "We're Jammin'" by Bob Marley. And I have to say that we now have a dog on the panel who is wearing a flower on the collar. So we are officially jamming. This is fantastic.
This is Penny. She's having a little nervous moment here. So it's either barking or my lap. So yeah, she's going to.
I'll bring Billy in a minute. We have Billie Jean, so I'll bring her in to join Penny. So, I think one of the things I'll share about Gateway Foundation as well for others that are listening, one of the first things that I did when I started at Gateway is I asked our human resource team to do a salary study looking at specific demographic differences of our workforce of women, of people of color, and we found that there were no wage inequities based on who they were and what they looked like. And I was so proud of that. I've joined an organization that has successfully built policies that have really maintained an equitable environment. What is hard about the LGBTQ community is there's not something I can type in the computer that says, let me look at people that are of this group versus that group versus that group. And so I don't know, frankly, if that is true in our organization. And so part of the dialogue that we've been having, and it's not just about compensation, it's also about opportunity. So part of what we're having as a dialogue right now is really, how do we evaluate those non-measurables? And how do we evaluate the differences in community that is not a box that one has checked, in our employment systems? And I think that what we're real excited about is, and this is happening nationally, we didn't make this up, but really having some focus groups within the organization that share their experience at a deeper level, but that also are support groups for people. And I, one of the expectations I have is that I think it'll be an incubator for opportunity and education for me, as a leader of the organization. And so I think one of the biggest things leaders need to do is maintain an open dialogue with their workforce, make themselves vulnerable, ask the hard questions, and accept the answers when they're given. And I think it's just so important. So I have 2 questions left. The time is really flying by, and this has been fantastic. So I want you to have in the back of your head what the last question will be to each of you. And that's going to be if you could give a 3-sentence kind of call to action for those on the call. And I think that's one of the most important things, really, that I hope we get from each of you. But the question I want to ask before that is really, who we are as people really kind of contributes to who we are as employees, as leaders, as partners in the world. I'd like each of you to share about how your membership in the LGBTQ community has influenced who you are as a leader within the healthcare industry. And Mark, I'll start with you.
Well, I think probably it has shaped, it's interesting. I was reflecting on that among the LGBTQ community, the incidence of substance use disorder is percentage-wise significantly higher than in other communities. And I certainly think that being in a job where we're trying to help fight that disease has certainly probably been very influenced by what I see in the community, what I see in the areas that I navigate. And, going all the way back to the 80s when the Joint Commission recognized that issue and required only for substance use disorder clients to determine sexual orientation as one of the requirements in their standards, only for SUD, no other parts of healthcare, but that. And so, I think that understanding that for a lot of people in our community, the difficulty of navigating the community and the world, certainly as it intersects with the disease of substance use disorder, is very, very difficult. And so I think that certainly has influenced how I've wanted to, wherever I've worked and for the time I've been at Gateway, be sure that we are offering just the best treatment for everybody.
Oops. I think we're having bandwidth issues with Mark. Okay, so let me go to Jim. How do you feel like your history has influenced you as a leader in healthcare?
My history, being a nurse, being at the hospital, starting out at the hospital where, if there was a gay person in the hospital and their partner came up and asked you how this person's doing, you weren't able to help them. They wanted to be like, I came from the ICU. I was the ICU manager. We weren't allowed to let families into the ICU. Partners were not considered family back then. So as I grew as a leader and I opened the ICU up to partners and significant others of the same sex, I went against the hospital and gave information to those folks. Eventually the laws did change and it was accepting. Being at Gateway, I tried to be a leader of acceptance, caring, treating everybody the same. So, and that's what I try to educate to everybody that I come in contact with. Be acceptant of everybody, be caring, treat people the way you want to be treated.
That's great. Thank you, Jim. And for John and David, I think the question is a little bit bigger for each of you as well, because you've also dedicated, decades to working specifically to support people who are living with HIV, people who are living with AIDS, members of the LGBTQ community. Share a little bit about how those experiences, and John, I'll start with you, have really influenced who you are as a leader. And even, I think the inspiration, maybe it's an obvious question of why have you dedicated so much of your life to that channel? But if you can try to touch on those different issues.
Sure, lots to pack in a short time. So first of all, David hired me at AIDS Foundation 15, 16 years ago. So David, thank you for that opportunity and everything that I've learned from you and continue to learn from you. I think what motivated me initially and continues to motivate me today is, just growing up as a kid in New York City. AIDS was everywhere in the 80s, and just trying to understand the stigma, the horror of the disease, and then where we got to in the early 2000s when I entered the HIV field was a very different place, but still so many of the same problems and still the same racial disparities and ethnic disparities that we see today, and so. I think today HIV is very much a social justice challenge that we have to address, and so that's one of the lenses that I see our work as. And I think one of the things that motivates me every day is the fact that we now have the power to end the HIV epidemic in Illinois and the country and the world, and it's ultimately a political decision to make that happen. And so building that political will is part of what we do every day at AFC and in the community in Illinois.
Thank you so much, John. David.
Thanks, Tom. It's such a huge question. I'll try to give a brief. I think, HIV, the pandemic, that dawned in the early 80s, in many ways catapulted, the LGBTQ liberation movement. And, it taught us that, that life is short and fragile, exactly what we're learning on COVID. And we have, and no one will stick up for us if we're not willing to stick up for ourselves. And that's why the AIDS Foundation Chicago was created, because that's why Howard Brown was created. We're really an organization that shouldn't have to exist. We shouldn't have to raise our voices to mobilize government and the health and social safety net to respond to the needs affected by HIV, or to provide high quality, non-judgmental and affirming healthcare for gender and sexual minorities. You should be able to receive attention for HIV or receive kind, affirming, expert healthcare wherever you go. But that frankly is not the case. And it's not only lack of knowledge or ignorance, but actual, in some cases, sanctioned discrimination. Under the Trump administration, there were efforts to empower individuals who had animus towards LGBTQ people to deny them services, to deny them vital care. And so, so that's why coming out, that's why pride is really about resistance. It's about saying, no, we're here, we exist, we're in the world, we deserve to be happy, we deserve to be liberated, to have the dignity of healthcare, of services, of civil and human rights, to pursue our dreams and take care of our families, just like anyone else. And I guess my call to action would be for I think Marky said those small but really gentle things really make a difference. And when I encounter straight allies who are very careful about their language and very careful about taking out some of those, their language is really infused with so many biases. And so I really appreciate when people don't assume my sexual orientation, or they'll ask, do I have a partner? Do I have a spouse? Or people who who talk about their sibling, who take out the gender and some of this language that is kind of heteronormative. Like, who's your wife? It's a heteronormative question, as opposed to who's your spouse. And it's just a small little thing that just sends a cue that you are not making assumptions, and you're allowing the other individual to reveal themselves if they want to. That, and really supporting equity in a systemic way, in your company, in the world, standing up for better policy and law that will protect diverse people everywhere in Chicago and around the world. So it's a big call to action, but I think
It's not a bad point to actually end on. You know, we are at the end, so we don't have time for each of the individual ones, but I think David has spoken really for the panel. And I think the last thing that I would share to take some license is, you know, I think we can look to children to really get guidance on how we should act in many ways. There's a certain age where they start to lose touch with love. And what I mean by that is universal love. I remember him describing, one of my younger sons, describing one of his classmates, and he said, well, he's the one with brown skin, you know, that in his mind, and he said, he's the one with blonde skin, you know, that was his interpretation. And I remember when he asked me, like, what is this Pride Parade about? Like, why is this big party happening? And the best answer I could give him is it's about love. So walk with love. Thanks to each of you for participating today. You know, if you're listening to this, try to figure out how you spread love and acceptance and equity and inclusion to all people. So thanks to everybody. Have a wonderful day.
Thank you.